Hi, I'm Kat, and I have just got my first dose of Ozempic. Now, I'm not a diabetic, but I'm using this for weight loss. Today's date is the 4th of May, as you can see, 2022, and I'm going to take you along for our journey. So this morning when I jumped on the scales, I was 88.3 kilograms, and I am 163 centimeters tall. I'll stand back so you can see front, side and back. Now you're going to learn how to do this with me because I have literally just been to the chemist, grabbed my pen, and I've got the instructions here. So first step is we open this up, and there is the pen in there and also all the needle tips. So it says here that I've got to prepare my pen with a new needle, and also to check that that's a nice clear liquid, which it is. So I'm going to grab a needle out of this little box here. So you can see there's a heap in there. So I'm just going to grab one so it's nice and sterile. My hands clean. Okay, so first of all, it says to pull the pen cap off, which we've done. Check the solution is clear. It's clear. Next, we take a new needle and tear off the paper tab. There we go. You can see, nope, it's not going to focus. There you go. You can see that little teeny tiny needle in there. I'm not scared of that. Push the needle straight onto the pen and turn until it is tight. So I've pushed it on there. Turn it until it's tight. So that's tight, I can't twist that anymore. And then it says pull off the outer needle cap and save that for later. So that's this one. So we'll save that for later. And pull off the inner needle cap and throw it away. So that's that teeny tiny one there. So can you see this? Actually, in front of the black's probably better. So that needle is all prepped, ready to go. Always use a new needle for each injection. Good to know. Okay, so before your first injection, you need to check the flow. So we're going to go to, on the side here, so where it says 0, we're going to twist this until it's got the 2 little dots there. So just give that a twist. And now hold the pen with the needle pointing up and press and hold the dose button until it returns to 0. So there we go. And you can see on the top there's like a teeny tiny little drop. So that means that it worked. So that's good. Okay, so now we are selecting a dose. So your doctor will prescribe you your dose, but mine is 0.25. So I'm going to twist it around to 0.25. There we go. Gosh, I was wondering when it was going to get there. So that's on 0.25 now. And then next we're going to inject the dose. So I might stand up for this because I'm going to put it in my tummy. So the lady at the chemist, she said, I'm just going to get an alcohol wipe just to wipe my tummy first. She said to go where your belly button is and then come out to the side of your belly button about, about this far out. And she was saying that, say if I start on the left of my belly button, the next week I'll go to the bottom, and then the next week the next side, and the next week the top. Okay, so I'll stand up so you can see. So belly button, I'm going to start over this side. So I've just given it a little wipe with alcohol so it's nice and clean. And then it says to not put your fingers anywhere on this part that needs to twist. and you press and hold down so the needle goes into the skin, and then I'm going to hold this down until it says 0. And then 1, 2, 3, 4, 5, 6. So that's in, and then I can pull it out. So that's the full dose is delivered in my tummy. That didn't hurt, so that's good. And it's back on 0 again. So that worked. Okay, so now after your injection, we're going to put the cap back on. And then once it's covered, you push the outer needle cap and you unscrew the needle. So unscrew that. Okay, so I've got that there. Now I have a sharps container, so I will put that in there. It says dispose of needle after your injection. And then you want to pop your cap back on, and this goes back in the fridge. That was super easy. So now I just know that every Wednesday at 4 p.m. I'm going to do my injection. So for 4 weeks, I'm going to keep it at 0.25. But I'll let you know, I'll do a weigh-in next week so you can see. Hope that was helpful. Bye.